That's why it's so important that everybody become an advocate for people going out and getting help if they have mental illness.
Absolutely, Dr. Quinn. I think everyone plays a part in this problem in our society, because it is a bad stigma that people think of when you have a mental illness, but it's something we should be more open and honest when talking to our loved ones with. So what are some symptoms that people might need to be on the lookout for?
Well, I just had this discussion with a patient, because I talk to my patients before I come on to prepare, and I explained all of these warning signs and symptoms that people may exhibit. We as neighbors, family members, church members, we need to look out for our fellow friends and people in our community. If somebody is acting erratic, different than normal, say it's a person that's usually happy, hey, how you doing? But they're down a lot lately. Or say, for instance, they used to like to go bowling or go to church every Sunday, maybe go to the movies, and they don't want to go anywhere. They become secluded, like a college student that maybe just stays in his dormitory all the time, and when he comes home, he's not really talking. Or they have some type of change in their performance, like maybe their grades are going down, or maybe they're having problems in their marriage, or they're maybe drinking a lot or doing drugs. These are all warning signs, just something that's different than normal for that individual. It's very important that we become advocates and, advise them to go talk to their primary care provider. And we as primary care providers, we have training to ask more questions to determine if that person would benefit from seeing either a psychiatrist with potential medication or even a therapist with just counseling.
Absolutely, Dr. Quinn. And everyone can have a down or a sad day, but what is that key time frame to really start to consider maybe they're struggling with mental illness and not just having a bad day?
Well, that's why I said it's best to try to get them to go see their primary care provider first, because we know what questions to ask if they need to go see a psychiatrist, to possibly start medications, or just go see a therapist. I even shared with the patient today that when I was in medical school, I made such poor grades my first semester, and it just devastated me, because when I was in college, I made such high grades that got me into medical school, and I was ready to go back to Mississippi. So my professor advised me to talk to the school therapist. And what she did was, she didn't advise for me to go see a psychiatrist and get on medication. She just put me through sessions where we would change my perspective through communication with one another. And she helped me understand that it was just such a blessing to be in medical school, which she reminded me that most of the people in my college classes had aspirations of going to medical school, but they didn't make it. And I should just be very thankful, which I realized I was very fortunate, and I became very thankful. My confidence went up, my anxiety went down, and my grades went up as well. And I graduated, and I'm here today. So
That's
therapy
awesome.
can be great for so many benefits in life. I've seen patients go to therapy, become better parents, better workers, just overall better person.
That's so good, Dr. Quinn. I love to hear that. And speaking of seeing a psychiatrist or a therapist when you are needing that extra help to really get through a season where you're struggling or mental illness, how can people fight the stigma of mental illness?
Well, like I said, we just have to be advocates for our fellow Mississippian or fellow American. Let them know there's nothing wrong with it. It's actually a good thing. Like I said earlier, I've seen people become better parents, students like myself become more successful students, people performing better on their jobs, getting raises, getting promoted. Just let them know that it's a good thing and it could actually help you.
Mm-hmm. Absolutely, Dr. Quinn. I really appreciate those tips that many of us can benefit from. Even if you're not currently struggling, we all go through ups and downs in our lives. So this is definitely something to consider for the rest of your life and for those around you, your loved ones, your neighbors, and people, your friends or family. So thanks so much, Dr. Quinn, for this week on Wellness Wednesday. We'll see you again next week.
Hey, thank you.